It is with great honor that we invite Dr. Abdullah Khaleel to the stage. Dr. Khaleel is a highly esteemed orthopedic surgeon with over 15 years of experience as a consultant in orthopedics and sports traumatology. As the head of the arthroscopy and sports injury department and also leading the quality department, he has made remarkable contributions in both clinical practice and healthcare quality improvement. With an MBBS from Ennapoya Medical College, Masters in Orthopedic Surgery from Sri Ramachandra University, Chennai, an executive post-graduation in management from IIM Calicut, and a fellowship in knee surgery from Lyon, France. Dr. Khaleel brings a unique blend of surgical expertise and leadership. His deep knowledge of arthroscopy and sports injury treatment has earned him great respect in the medical field. We are privileged to have him share his insights with us today. Please join me in welcoming Dr. Abdullah Khaleel to the stage.
My area of talk today is lean management in healthcare. As you all know, lean is a concept by Toyota. For the last, I think I'll be speaking in English a lot because a lot of students are here and they want to hear in English. I will not be coming down into Malayalam mostly, but I sometimes will use Malayalam words a little bit. Anyway, so what really Toyota has made? When I was studying in my Indian Institute of Management in Calicut, what I saw is that a lot of case sheets, what we learn about business management is about Toyota. Why Toyota has made that great impact on all the management studies is basically because Toyota has introduced a concept called just-in-time or lean management, in which they could outstand or outperform all other car industry when they came from small country like Japan. For example, from US, there is car manufacturers like Ford, which has started years before Toyota, Chrysler and all, and if you speak a country from a country like Japan, a small country from Japan, where the resources are small, and they want to come into a industry like American, and they want to get into a profitable business, they really had an issue to come up like that. So what they did is, they make things which is necessary in the necessary time, in the necessary way. That is what lean means. Okay, so and they outperform all the Honda or the Ford or Chrysler and all other car industry, and they became one of the leading manufacturers in the world, and they are still the top manufacturers in the world. So what is lean management? Lean management basically is a big topic to discuss, but let me talk to you about 8 waste managements which you have to eliminate in all your day-to-day practice. See, Toyota is a manufacturing industry. Then how this lean waste management can be implemented in a service industry like hospital? That is what we really have to think about. So there are Taichi Ahno, the founder of Toyota, had 8 waste concepts or waste topics which he implemented in his manufacturing field, so that he could eliminate all this waste, he reduced the cost, and the profit has been increased. One of the first thing is inventory. So what does inventory means? Inventory means is a tied up capital. See, for example, if you have too much of a stock of pharmacy, that is the management's that money there in the pharmacy. So we really required only what we required for that particular moment, and has to be when we sell it, the correct purchase has to be done from outside. So what we really mean about a inventory management and avoiding waste is about just in time what we require in the pharmacy should be there. There should be no surplus amount of inventory stocks available in the pharmacy. For example, what we did in our operation theater, we have almost 8 laminar airflow theater. Before, we used to keep, every theater used to have some stocks inside. So what is happening is lakhs of rupees of stocks are dead in that theater. What we did is we made a pharmacy inside the theater complex. We put all our stocks in the pharmacy, and whenever we require that amount, like for example, I'm posting a case of an ACL surgery, our sisters will indent what she required for that surgery and bring it from pharmacy. So they don't have to really put all the stocks in 8 theaters and keep our money waste in that each theater. So that's what the industry waste management means, inventory. The next is waiting. See, any hospital, the satisfaction is about for the patient. See, all are patient-centric thing. So when you are talking about patient satisfaction, they have to get their things done in the as fast as early as we can. So turnaround time is something we should be very careful about. So for example, in a patient setup, like patient is waiting in front of you as a doctor. So we don't want the patient to be like in old theory. The lot of patient has to be they have to have a big waiting area. All doctors are waiting, all patients are waiting in front of a doctor. So that concept has changed. So now we should get even in a like in a car industry, you should get a message what time is your appointment, correct appointment time, and the patient should be coming in that time, and within 10 minutes of time they have to be seen. And the biggest thing what in a hospital is lab, radiology, and it's the main thing in the doctor. So lab people, what will they do is then hemoglobin in the latest equipment will take hardly 2 minutes, but they'll write 30 minutes turnaround time. It will take 30 minutes to do. So what happens is that the patient satisfaction will reduce, and nobody want to come to a hospital of that sort where you take a lot of time for your turnaround time. But for example, if the patient is coming into a hospital and they want to see 3 departments, and it requires another 1 more day to come into that hospital, the patient will have a lot of patient dissatisfaction, which in turn will reduce our patient flow into the hospital. So that is one big thing which we have to really look about. That is the waste in waiting. The third thing is defects. So what is waste in healthcare industry? Defect type of waste in healthcare industry. It is especially or it's not a nut or bolt which is defect. It is always a medication error or something medical the doctor is doing to the patient. For example, there is something called as medical error. For example, when I'm talking about one fine day, our urologist is telling that I want to do a renal transplant. See, as such, a urologist of MCH degree, he can do a renal transplant because in Kerala or in India, you can do it because he is trained in that. But in a private hospital, when they come to a hospital like this, and if they are telling about they want to do a renal transplant, we will always ask them, what is the credential to do that? Are you sufficiently trained to do it? Do you have certificates to do it? And are you sufficiently trained to do it? And do you have a cadaveric exposure for it? Or do you have assisted under somebody to do this particular surgery? So if you don't do that, one fine day, one surgeon is going to do an operation. Okay, after that operation, he will have an error and he may go from this hospital. But that makes a bad reputation for the hospital, and it will in turn will reduce the patient inflow into the hospital. So that is one thing, and misdiagnosis also. So what we do in a hospital like ours, in a 5th edition, like when NABH latest edition going on. So what we'll do is we will have a credentialing polling chairman committee, in which we'll have at least 5 to 6 senior most doctors in that. And if somebody is telling that I want to do a knee replacement tomorrow, it will be okay. Bring all the certificates what you have and the privilege what we will give you the privilege if you are really into it. So simply not like that. If somebody is telling I want to do an ultrasound tomorrow, onwards I am a fetal medicine guy. So it doesn't mean that he is a fetal medicine guy. He has to undergo a sufficient training to become a fetal medicine specialist. So that is what a credentialing and privileging the thing. That is how you can reduce a waste management defects. And next thing is transportation. See, transportation is and another thing which we are really looking for is like when you have an emergency room. So, and you have another in one corner of the hospital, like this hospital, you have a 100-meter hospital, 120 meters I think in the span of this hospital, and in one end you have an ER and another end you have a X-ray room. That makes a waste in transportation, that much of movement. So we had to make sure that the ER should have an X-ray room nearby, a CT scan room nearby, so that there is no transportation for a patient who is coming really sick into the hospital. Okay, so that is one type of waste elimination which we can do in transportation. And another thing, for example, for a satisfaction of a patient, like an OG mother, like obstetrics and gynec mother is coming to the hospital and she has a small child. If her gynae doctor and the neonatology doctor which she wants to show it to the next doctor is not nearby, the OPDs are totally different areas of the hospital, the patient will not be happy to have such a to go to such a hospital. They don't want that long distance between two areas. So that is another waste area where we had to look about, and that is lean in transportation. Something called as motion is lean in motion, like you how to reduce waste in motion. Like in a health care industry like ours, when nurses used to run for lab reports, for discharge summaries and all, like before, like past, it was like that. Nurses used to run for everything. They used to do bed making, they used to give the medicines, they used to give documentations, they used to do the discharge summaries, everything. See, what really mean in a waste management or lean concept in a motion is like, let the ward secretary take care of the inventory part of nursing. Let the ward secretary take over the daily stock management and everything. Let the nursing assistant take care of the bed sheet management and bed making and all this stuff. And let the sister or the nurse take care of real what is health care, the patient care of the hospital, of the patient. So it will reduce the unnecessary motion and unnecessary burden to the nurses, which in turn will increase our patient satisfaction. So overproduction, as you know, it is not the overproduction of any car parts or anything like that. But in a hospital, when you talk about lean concept in overproduction is, we should always reduce the duplicate test. It happens in OPDs and a duplication of medicines. So this is what we like. For an example, for a patient is admitted at discharge, three doctors have seen the patient. Three doctors will write sometimes the same medications, and it is not duplication, is more than that. So it can even cause a patient harm. For example, if it is a pantosid and oocyte, or like something like peptic diseases, it is not much of a problem. But if you really are talking about something like ecosporin, which is given twice the dose, and something like that, which is, or warfarin, which is given twice the dose, it will cause a lot of problem for the patient, and in turn is a bigger issue. So another thing is over processing. See, whenever you go into hospital, or we are talking about sisters, you will always see sisters are writing notes. Our Shirley madam used to bring new documentaries, forms, and she will tell, we want this form also into it. So I used to tell Shirley madam, please reduce some of the forms, then I will try to introduce one of the forms. Because see, the patient cares something and documentation is another thing. See, patient care is a must, documentation also a must. In a documentation, you should have the exact documentation. We don't want the same thing to be written again and again, and the nurse to sit on that documentation. We don't want that. We want the patient, nurses to be in the patient side, seeing what has happened to the patient, and what to be given the correct treatment. What happens is like there is another one form in that way, this form in that way. Everywhere they write the same thing because they don't know what to write everywhere. They will write stable vitals, vital stable. Again they will write vital stable, stable vital. The same thing will happen again and again, whatever you teach them, because they don't have anything to write. That's the reason. So it is called as a over processing type of waste, and we should always reduce always eliminate that type of waste. Unused creativity. See what happens in a nursing. I take this nursing as an example because it happens in the doctors, it happens in other, even in a cleaning staff. But what happens like in a nursing, it will be very easy to correlate. See, these people learn 4 years of nursing and come to a ward. But in the first day of the ward itself, they had to put IV cannula, which they have not done in their UG days. Okay. So now what happens? If these people come on in a hospital setup like this, and first day itself they had to put an IV cannula or a tracheostomy care, which they have not just learned theory. Yeah, this will take almost 6 months for them to learn this process, this document, this procedures to this thing. So their creativity or their usefulness is gone. So it is a big headache for the HR. The HR has to teach them, induct them, and train them before they are putting into the thing. But they are also fed up, because in 2 years of time, this all people will go to UK, and again there is a shortage of staff, and they have to take the new fresh staff. Again, the same thing happen. But we should have some HR policies so that this type of an waste of creativity or whatever, the HR waste has to be eliminated in a health industry like ours. The final thing, which that's the 8 waste which I talk about. But the basic thing about all this waste is like the 5 S. It is like self-discipline of a employee. So what is 5 S? One is sort, set in order, shine, standardize, clean up, and sustain. So this is like if they have an office, they have to sort out the unnecessary things, set the things in proper manner, and they should make sure that the workplace shines. I meant to say the workplace should be clean and clear of clutter, and it should be standardized according to the protocols, and it should have that habit of sustaining that same thing clear. So what I really want to say is that, and finally, lean concept is introduced in a lot of hospitals world over, and it can reduce the cost of the hospital running. And if it is properly implement, and if you are talking to the all the category from doctors to the screening staff, and if you teach them properly what really lean is, you can have a very good quality treatment in an affordable cost. Thank you.